Hi, my name is Tory Newmyer, and this is my survivor story. I'm 39 years old, and I'm a reporter for the Washington Post covering the intersection of the economy and politics. I was born and raised in Washington, D.C. I went to college in New York City, and I spent a year after graduating in Chattanooga, Tennessee, writing for the daily paper there. I've been back in Washington ever since, first covering money and politics and writing about Congress for a newspaper called Roll Call, then for 7 years as the Washington writer for Fortune magazine, and I've been at the Post for 3 years. So that is my 1 minute CV. I was working at Fortune when I was diagnosed in February of 2016. For weeks, I'd been dealing with a rolling, worsening, all-over body itch. I had no other symptoms, and I wrote it off as something that was brought on by work stress. Then on an unseasonably warm, late January afternoon, a Sunday, I was sitting in my backyard with a couple of friends, and one noticed that my eyes looked yellow. I went inside and looked in my bathroom mirror. He was right. I had no idea what was going on. I'm not sure if in that moment I connected it to this thing I'd been experiencing with the itching. But that Tuesday, I was in the bathroom at work, and my eyes looked worse. I called my stepfather, who's an allergist in Washington, and he understood immediately that the jaundice could only mean there was something wrong with my liver. He arranged for me to see a GI immediately, as in right then. I got an MRI that afternoon and a CT scan the following day. The day after that, a Thursday, I went back to the GI's office to find out what was going on. My stepfather drove me. He said it could be hepatitis. I asked if cancer was a possibility, and he said he couldn't rule it out. I'm not sure about this, but I'm reasonably confident he knew, or at least had a good understanding of what I was up against, and that's why he wanted to be with me that day. When we sat down with the GI, the doctor explained I had a 7-centimeter malignant tumor at the porta hepatis in my liver, occluding my bile ducts, causing bilirubin to flood my body, hence the itching and the jaundice. He was also crying, which I took as a bad sign. He said he had sons my age, and it wasn't fair that I had to face this. I didn't ask for a prognosis then, and I never did. In fact, from that point, I started all first-time consultations with new doctors with a sort of preamble about how I didn't want to hear percentages. I decided there was enough about my case that was unique to render them meaningless. I had my relative youth, and the fact that my cancer was classified as advanced because of the size of the mass, but hadn't spread and was limited to that one lesion, and that we appeared to be at an inflection point generally, where advancements in cancer treatments were arriving so fast that the body of knowledge seemed to be turning over every several months, and a 5-year survival rate based on old data presented an inaccurately grim picture for new patients. Mostly, of course, I was just scared. I could deduce what I needed to know by the tone of my friends who'd obviously done some Googling. The following week, I went to Johns Hopkins to get 2 stents placed in bile ducts, and my bile ducts to open them back up. The doctors were able to get a tissue sample from the tumor during that procedure, which went off to Foundation Medicine for genetic profiling. I also met with a surgeon there who told me that the tumor was inoperable. It was too close to too many important structures to offer any hope of removing it with a good margin. The day after the stent procedure, I trained up to New York with my mom and stepdad for another consultation at Memorial Sloan Kettering. The surgeon there reached the same conclusion about the possibility of a resection. So I started on a Gem-Cis regime. Aside from the fatigue, I tolerated it about as well as I could have hoped. More importantly, the tumor showed what I was made to understand was an unusually big response, shrinking by roughly half over the course of 4 cycles. We decided to pursue a surgical option again, either a resection or a transplant. My brother-in-law, a tech entrepreneur, set up a spreadsheet with every transplant center in the country, along with all of the relevant available data about how many procedures they had performed and their success rates. My family divided the list and got in touch with all of them. I was mostly dismissed out of hand. A few places said, essentially, maybe, if you irradiate the remaining lesion and demonstrate stability for some period of 6 to 12 months. One, Dr. Jean Imond at Columbia Presbyterian, said he couldn't offer a transplant, but he could resect the tumor. and he could do so immediately, and he thought safely and successfully with a high degree of confidence. A bird in the hand, I thought. Let's do it. The surgery was a big success. Clean margins, no sign of spread. The recovery was rougher than I expected, but by July I was strong enough again to start an adjuvant regime of oxaliplatin and Xeloda. It was much rougher on me than the Gem-Cis. Most notably, I experienced pretty intense fatigue and neuropathy, so I was relieved to be done with it in November of 2016. My scans remained clear for more than a year. Then, in January of 2018, I got some bad news. My latest imaging had turned up 3 or 4 new lesions in my liver. That dark curtain of dread descended again. I had to go to Switzerland for work 2 days after receiving the diagnosis, and I remember walking around the streets of Zurich saying goodbye to Europe in my head. I was doubtful I'd ever be back. When I got home, my family and I went back to the drawing board. And here I've got to back up on my timeline, if you'll indulge me, to bring you up to speed on an essential part of my story. You'll recall I said I was hanging out with a couple of friends in my backyard in January 2016 when I noticed my eyes looked yellow. Well, before that conversation took that turn, I was talking to them about a woman I just matched with on a dating app. Her name was Kim. She had just moved to Washington from Chicago, and as I caught up with my friends, I was texting with her, making plans to take her out the following weekend and show her around. I didn't draw the connection from my friends, but I do remember telling them, I'm going to meet my wife this year. I had a feeling. A few days later, a few hours after my diagnosis, I texted Kim explaining what I just learned and canceled our plans, explaining I wasn't going to be very good company. I figured that was that. But when I'd recovered enough to feel okay in the fall, we found each other again, and by the time my cancer came back, we'd been together for more than a year. When I returned from Europe, she came with me up to New York for a visit to Memorial Sloan Kettering. Dr. Maeve Lowry, the doctor there who'd coordinated my care 2 years earlier, had since accepted a position back in her native Ireland. The doctor I consulted instead didn't see much hope for me. He thought the disease had spread into my abdomen, and he recommended getting me into a trial for an agios drug called AC20, now known as Tibsovo, that targets the IDH1 mutation I learned I'd had from the Foundation Medicine's tissue analysis 2 years earlier. His thought was it could buy me some time. Unsatisfied with that strategy, I flew down to Houston a couple of days later to meet with Dr. Milind Javle at MD Anderson. He ordered his own scans that returned encouraging news. He saw no evidence of spread. More, he believed the lesions were treatable with local interventions. We started with a systemic approach, and I went back on Gem-Cis, this time with Abraxane added into the mix. After several cycles, my lesions remained roughly the same size. That summer, I made a couple of return trips to Houston, the first to have 2 of the lesions ablated, and the second to have the others radioembolized with Y90 microspheres by a doctor named Dr. Adisio. The doctors considered the procedures to be a big success. Dr. Javle thought, based on my response and the apparent indolence of my disease, I'd make a good potential candidate for a transplant, assuming I remained stable. He arranged for me to meet with the liver transplant team at Houston Methodist, first with Dr. Stephanie Lunsford and then with Dr. Mark Gobriel, who has pioneered transplantation as a cure for cholangio patients with certain disease profiles. Against, I should note, what I understand has been resistance from within the medical community. They agreed to take me on. Throughout that fall, I took AG120 daily, which I tolerated so well I essentially didn't notice it. I don't know if it worked, but it didn't not work. I developed no new lesions. I breezed through a transplant evaluation in early December, then returned to Houston after Christmas with Kim to wait for a liver. We got the call on a Sunday, January 27th. I'm told the surgery was difficult. It took 4 different teams 12 hours just to get through the first day. The Y90 had succeeded in transforming about half of my remaining liver into the consistency of cement. I was under for several more hours on Tuesday as the surgeons formed a jump graft to connect a major vessel of mine to a smaller one in the teen donor liver. They finally finished sewing up my fascia that Friday. Recovery was a soldier's crawl. I was in the hospital for nearly 2 weeks, and I had to be rehospitalized in March for nearly 3 more weeks, thanks to a blood clot that formed at the jump graft. I also had 3 hernias and a staph infection. Once we got those under control, I made much steadier progress. And the truly amazing news, the analysis of my old liver showed no evidence of live disease anywhere, which I think represents a first, and my scans have been clean since. Kim and I returned home to Washington in early May. I went back to work later that month. Then one night in August, on a beach in Puerto Rico, I asked her to marry me. And this was, I don't know if I can, sorry for the low tech. This was us in January. So what did I learn from this that I'd like to pass along? A tremendous amount. But in the interest of everybody's time, I'm going to narrow it way down. If you're a patient tuning into this program, live or otherwise, there's a decent chance this won't come as any great insight. But one of my big realizations upon getting this disease was that this time, now, is the greatest moment in human history to get this disease. It's the greatest single moment to get this disease, except for any time in the future. We are learning so much so fast, and the armory we can now deploy against this thing has grown so much, you really do have options. The difficulty is in sorting through them. The profusion of new tools gives you a lot of choices to make, and they bring with them a lot of uncertainty. I met with a lot more doctors than I mentioned in my recounting of my experience. And another thing I learned from all those consultations was the best doctors I found approach this disease not with a hammer, but with a Swiss Army knife. Given the rarity of the disease and the unique profile of each patient, I think you want someone who thinks about you as a singular puzzle. If a doctor is unerringly certain about one course of treatment and unwilling even to weigh out the equities for you of the competing alternatives, then either they're projecting false confidence or genuinely not thinking creatively enough and considering enough options. I also want to say to all of you on the front lines of fighting this disease, whether you're in the research labs, or those doctors and nurses and other caregivers dealing with patients daily, or an advocate on behalf of all of us, like Stacy and everyone involved with or supporting the foundation, you are all my heroes. I want to thank you from the bottom of my heart and on behalf of my family for being part of the fight that saved my life and has brought relief and hope to so many others. There's a special fortitude required of the researchers, caregivers, and advocates who take on this disease. Most people have never heard of it, and the crushing setbacks and disappointments too often overwhelm the successes. But I hope you'll think of me, the odds I have faced, and the outcome I've managed to enjoy so far despite them when you encounter frustrations. Your will and commitment, and your compassion and your brilliance help see me through this. Let's all keep fighting to make more of these stories possible. Thank you for your time.